So when you look at the future of yoga, this is what I'm primarily talking about today. I would like to stress on 3 points which I think will define the future of yoga and mental health. The first, of course, is we need to do rigorous scientific research and establish yoga as a scientific method, rather than, people think of it as a very esoteric kind of a therapy. The second point is we need to customize yoga for people depending on both the modern diagnosis of their disorder as well as a assessment based on our traditional system like the guna or the dosha status. And the third major point is we have to overcome a lot of barriers to reach yoga to the population. One of the ways is Tele-yoga. So I'm going to expand on these 3 things. If you simply look at this, what has happened to research in yoga, it's a very good thing that a lot of scientists are now interested in yoga research. And as you can see, there is an exponential increase since the last maybe 15 years in terms of the number of yoga research papers being published. That also means, of course, that people are doing more studies. This is a meta-analysis published in 2012, which shows that across all psychiatric disorders or mental disorders, the effect of yoga is very positive indeed. A very strong effect size is here. Let me take 1 or 2 conditions just to illustrate what has happened. This is a meta-analysis by Kramer, who has done a lot of work on yoga, not primarily doing meta-analysis. What he shows in this paper is that if you look at all the studies up to that point of time, 2013, in yoga and depression, almost all the studies have a strong effect on depression. They show antidepressant action. This was one of the studies done in Nimhans in the last years of the last century, published in 2000 in the Journal of Affective Disorder, the first randomized controlled trial of yoga alone as a treatment for depression. 3 arms, yoga, imipramine, and electroconvulsive therapy. And yoga was as good as imipramine, although ECT was more potent. We know that. So these were for people with major depression admitted in Nimhans. We repeated a study without randomizing people. We allowed people to choose. Naveen, who did his PhD with Professor Gangadhar, here what he did was that he allowed people to choose yoga only, take medicine and yoga, or only yoga. As you can see here, all the things were statistically all were same, but there are important differences in terms of the mechanism, which I will show you later. And now it is quite common in the West also to see yoga being used as a therapy alone for depression without medication. So there are 2 of these papers using Iyengar yoga and Dr. Sudha Pratikanti using her own version of yoga in the United States. We also have done a small case series, which I have not shown here. The other major bugbear for us psychiatrists is schizophrenia. And here, this was the first study. Of course, S. Vyasa did a study back in 2000. They were the pioneers in trying yoga for schizophrenia, S. Vyasa Yoga University in Bangalore. And Nimhans has taken over the mantle, and we have done quite a number of studies now. Ganeshan Doraiswamy, doing his MD thesis, was the first to show that yoga produces a significant improvement in what we call as negative symptoms of schizophrenia. This aspect of schizophrenia is very difficult to treat with medication. When I say negative symptoms, what I mean is that people are amotivated, they don't want to talk to people, they don't want to take care of themselves, they don't want to go to their job. That part is very difficult to treat with medication. Yoga produced a significant change. We repeated that study in another bigger RCT with 3 arms: yoga, weight list control, as well as physical exercise. And we were able to show again that yoga produced significant improvements in negative symptoms and social functioning, and a very strong odds ratio of almost 5 between yoga and the other arms. These 2 studies were picked up by the NICE guidelines in the UK, which is the prescribing sort of agency for the healthcare agencies in the UK. And they picked it up, and they have added yoga as a complementary treatment for schizophrenia in 2014, based on these 2 studies from Nimhans. We have replicated it recently. Dr. Naren Rao, working with the people in SCARF, that is the Schizophrenia Research Institute, again showed that yoga produces significant or statistically significant changes in negative symptoms. The other interesting part is that yoga has produced changes in what we call as social cognition. Now, the social cognition is a very important part of what we see in schizophrenia, that people lose touch with what we call as empathy. They are not able to empathize with others, not able to understand the emotions of other people. This is again very difficult to treat with medication, but yoga seems to produce this change. Again, we have replicated this study recently. Dr. Ramjayam, working with me doing his PhD, has again done this study. When do these effects start? We have been able to show in my ongoing study that within 1 month, we can see changes in these parameters in patients with schizophrenia. And at least 6 months, we were able to follow up and show that these changes persist. But how does all this happen? I would like to give you a brief glimpse only. Of course, I'm not going to take too long with this because of the absence of time. One of the ways is something called as cortical inhibition, our ability to inhibit unwanted things going on in our brain. This depends on a neurotransmitter called as GABA, GABA aminobutyric acid. And this is known to be poor in patients with depression. We tried it in normal people, and yoga was able to improve cortical inhibition in healthy individuals. This is an example of a single subject. It can be measured in milliseconds, and in this person, it almost doubled from 52 to 106 after 20 sessions of yoga. Does the same happen in depression? We were able to show that indeed it does. You can see this slide. People with depression, the pink or the orange in the left, the cortical inhibition was very low. Walking did not change it very much. Yoga, the blue one, was able to produce a change towards normalcy. Maybe if these people continue doing yoga, they would really come towards the normal, which is the orange on the right side. Another major mechanism, what we call as neuroplasticity, depends on or the marker is a neurotransmitter called as the brain-derived neurotropic factor, BDNF. Again, it is known to be low in depressed patients, and we were able to show that yoga done regularly increases this BDNF, which means the brain is able to, neuroplasticity basically means the brain is able to modify itself or repair itself. And this increased after yoga. Of course, it also increases after medication, after electroconvulsive therapy. So yoga is also a scientific way of improving your mental health. This is a very small but a very nice study done by Dr. Kalyani, the daughter of Professor Gangadhar when she was an MBBS student, which showed that Om chanting produces deactivation of the limbic area. As I remind you, limbic area is the center which sort of modulates the strongest emotions, particularly the negative emotions. And Om chanting, particularly the part of it, the Brahmari, you can also do it with Brahmari, reduces the blood flow this region and calms the brain. This is a recently published study done in elderly women who are practicing meditation for a very long time. Here they are called as yoginis. And as you can see, some areas were actually thicker, the cortical areas in these people as compared to other people who are not practicing yoga or meditation. This is a study from NIMHANS in a small population of elderly people. We were able to demonstrate a small increase in the size of the hippocampus. As I told you, with age, our hippocampus actually becomes smaller. But in this population, we were able to show, we are trying to replicate the study in a bigger sample, of course, but it's a preliminary indicator that yoga can indeed change your brain structure, not only function. So putting all this together, I have just taken the example of depression here, that there is a reduction in cortisol. I have not shown you that slide because of paucity of time. We are able to show that in many studies. When you do yoga, your stress hormone cortisol comes down. BDNF increases. There is improvement in EEG markers like cognitive event-related potentials. There is improved cortical modulation, that is GABA mediated. And together, all these things produce the changes that we see, which is improvement in depression, improvement in cognition, reduction in stress, and therefore, very importantly, risk of relapse. This is a critical point that we need to know, because you need to prevent the next episode, not treat it. Treating it with antidepressants is very easy, but the lifelong the person has to take medicines. On the other hand, if they do yoga, maybe they would need medicine for this episode, but they may not have the next episode. That's the most critical factor. And if it works so well on patients, you can imagine if you do yoga from a young age, you might never fall prey to any of these mental disorders. That's what we need to look at. So yoga at NIMHANS has progressed from purely research work in the Department of Neurophysiology, Clinical Psychology, to clinical work, which started in 2007, giving actual yoga therapy to patients. Dr. Gangadhar and Dr. D. Nagaraj, who started that, and we have moved on to now what we call as a Department of Integrative Medicine, which I described in the beginning. So this is a summary slide, just showing that we have shown improvement in not only symptoms, but possible neurobiological mechanisms for each of these disorders. Like depression, I have spoken to you. In schizophrenia, we have shown increased oxytocin and mirror neuron activity and improved connectivity of brain networks. As elderly, cognition in the elderly, as I told you, we have shown improvement in hippocampal gray matter volume. Similarly, alcohol dependence, anxiety, where the parasympathetic tone has been shown to get better. Some other disorders, of course, we are still at the level of showing improvement in symptoms. We have to still look at the possible mechanisms. The next major thing, which I think is the future for yoga, is specific yoga modules based on both their modern diagnosis as well as yogic assessment. For example, the Vedic personality inventory we used in a set of patients with different disorders, and we were able to actually show Hemant Bhargav, who is my colleague and the assistant professor of yoga in the department, was able to show that gunas were able to differentiate between different psychiatric disorders. For example, OCD has very high sattva guna and very low tamasic guna as compared to other disorders. So this kind of assessment will tell us what kind of yoga to be taught to each person, and that's what we have been doing. We have been able to generate what we call as generic but disorder specific modules for most of the mental and neurological disorders. Some of them are in progress. This is the work we have done, published. And how did we do it? We look at the literature search on the effects of common yoga practices. We look at the syndrome, psychiatric syndrome, try to match these practices, make a preliminary draft, send it to experts, validate, do a pilot study, and then do clinical trial and biomarker studies. We have tried to put it together in this book, which is now publicly available on Amazon. Myself, Dr. George, and Dr. Srinivasan from SVYASA are the editors of this book, and Hemant is the associate editor. And we have put all our work of 10 years into this book and also the modules. I'm very happy for people to use our modules as long as you yourself are trained in yoga. The only thing we ask is that you should be trained to teach yoga. Only then you should use these modules. YouTube, I don't agree, is a good teacher. Of course, third major problem is there are a lot of barriers. Like this study we did in patients with schizophrenia, distance is a barrier. Coming every day to a center is a barrier. Money is a barrier for many people. So how to remove this kind of barriers? One of the things is Tele-yoga, which COVID-19 has forced us to use. In fact, the government very early in the course of COVID went ahead and gave out an advisory on Tele-yoga services. We are also proud to collaborate with Ayush and the CCRYN on this. This has now become a guideline rather than an advisory. And we have also done some work. My colleague Aarti did a work on how to standardize Tele-yoga therapies, how to assess what are the guidelines for Tele-yoga therapy. And we have been able to actually practically teach yoga to our patients in NIMHANS while COVID was going on. We also selected a group, rather they approached us, the India Association of Greater Boston wanted yoga for their healthy subjects who are stressed because of COVID. And Mrs. Mangipudi, who is a senator in the US, was very active in this, and we were able to take a lot of sessions for them over 6 months. And in fact, we did a study on them, and we were able to show that actually their perceived stress scale decreased with the yoga therapy, their well-being improved, and a significant improvement in their ability to learn and practice yoga was also seen. So Tele-yoga is feasible and effective, even done over very long distances like this. And this is the paper that we published. The feedback, of course, was that They had better mental relaxation, improved fitness, reduced fatigue, reduced requirement for medication. And really, in the time of COVID, it provided a very positive and healthy engagement for them. This is just a snapshot of some of the yoga modules that we used. And we also took sessions for our own staff who are very much stressed because of the COVID pandemic. And even now, 1 week every month is going on specifically for our staff. We took a special class for children who were affected because of no schools were there, nothing was going on. So divided into 5 and 10 years and 10 to 15 years. We done it for almost 6 months. And even now we are running a early morning course for people all over the world. Around 40 or 50 people join us very regularly. This is an open one with anybody can join the yoga for stress. So coming to the last part of my presentation, I would like to say that COVID-19 has really exemplified the limitations of existing therapies, particularly pharmacotherapy, and the effect of stress on our health. Yoga, as we all know, but has been particularly emphasized now, is a very systematic method of training the brain to handle stress and increase a very important resilience. However, yoga, rather, we need to evolve in how to use yoga as a tool for helping patients with mental health disorders and helping other people prevent becoming patients with mental health disorders. Maybe use innovations like Tele-yoga. Thank you very much. I hope it has been a useful presentation. I again thank the Kaivalyadhama organizers for inviting me here.
Thank you for taking the time to be with us live today. We wish you the best for your research and hope to see you soon with us in Kaivalyadhama.